So welcome. This is the video on how to write a question from boardbank.org. This is advanced techniques. Okay, so there's a basic video that comes before this. I suggest that you would watch that first. So really, this video is really going to tell you what's the best way to write a question so that it mimics what is on the USMLE Step 1, your block exams, all the kind of exams you take in medical school. And the purpose, what I really want you to learn in this video is not only how to write a question, but understand that knowing how to write a question and what goes into writing a question will help you do better on these exams. So let's talk about the outline today. We'll go over a little of the cognitive science research, the basic rules of good question writing. We'll talk about the appropriate structure of a question. We'll talk about how not to structure a question, flawed question types, and then we'll give you some templates if you can't think of how to write a question. Let's get started. So we'll begin with some cognitive science research. So Karpicki and al. Published in 2011 in the journal Science this cognitive science paper. And really they wanted to understand what's the best way to retain information. In this study, students were asked to read a 276-word passage on sea otters. And each group had 5 minutes to read this passage, knowing that they were going to be tested on this later down the line. But after those 5 minutes to read, they were split into 4 different groups with different additional things that they could do. Now I want you to imagine that you're in this study, you're just reading this amazing passage on sea otters, and you have to choose which group you want to be in. So do you want to be in group 1, which doesn't get to study this anymore before the test? You just get that 5-minute period. Do you want to be in group 2, which they give you 3 more 5-minute sessions to study? Would you like to be in group 3? They get 25 more minutes to map out the main concept mapping. Or do you want to be in group 4? You have to do a 10-minute test after your 5 minutes of reading. Then you do 5 more minutes of reading, and then 5 more minutes of testing before you take the real test. Now, if you can figure this out, I'll tell you where you'd want to be. You want to be in group 4. This is a graph of the data, and it just shows how good the recall of all the things that they had to learn about sea otters was in each group. So obviously studying for 5 minutes was the least because you had the least amount of time. Repeated studying was a little bit better. Concept mapping was about the same as repeated studying. And then retrieval practice, which is testing, was by far and large better than all of them. So keep that in mind. Second study I want to talk to you about is by Yan and al. At UCLA, the Bjork Memory and Forgetting Center. And she published this in Memory and Cognition. And she really asked about getting things wrong. Her paper was entitled, "Why Does Guessing Incorrectly Enhance Rather Than Impair Retention?" So that gives away kind of the conclusion, but she wanted to study if getting things wrong actually helped you or hurt you. And what she found out after her study, what they did is they used paired words. So there's 2 groups. One group gets the paired words. They get shown the paired words, so whale and mammal. And then after 10 minutes, they have to take a test and recall what the paired word was. The other group got one of the words. They got whale, and they had to guess what the other word was. So what they would say is sometimes they'd say, I don't know, dolphin, ocean, could have been anything. All the people in the study got it wrong. Anyone that got it right was excluded. And then they had to take a test after they were shown the correct answer. So they were studying if you guessed wrong to begin with, did it hurt you or help you? And what they found was that guessing wrong actually helped you with memory and recall of that information. So the people that guessed wrong, it helped you. You know, and they give some ideas of why that is, but I just want you to keep in mind getting wrong or failing is good. And last study I want to show you is by Nestoko and al. In Memory and Cognition. And there was 2 groups. One group was brought into a room and told, you have 10 minutes to read this text You'll be tested in 10 minutes. And they took a test. The other group was in that room, and they said, you have 10 minutes. You're going to teach the next person who comes in this material at the end of 10 minutes. And what they actually did is that they were both tested. This group, even though it was told they were going to teach, they just were tested. That expecting to teach made you learn the information more. And this group did a lot better. So the bottom line in these C-test studies I want to emphasize is testing is paramount. Okay, testing is really important. Failure in a low-stakes testing is good. So getting questions wrong in like a practice test, for example, doesn't harm you academically. It actually helps you perform better on real tests. And the teaching is the best way to learn. You retain information more that way. And that's something we're kind of told throughout our life. All right. So now we're gonna change gears, and we're gonna talk about how to write a question. I want to just emphasize my source of information for this lecture is the MBME's book, Constructing Written Test Questions for the Basic and Clinical Sciences. This is an amazing book. It tells you kind of how to write a question in a good format. It's available free at this link to download the book. It really helps you. I think if you want to do well on the boards, it's a good book to read, to go through, to understand the test. All right. So what makes a good question? Here's the basic list of what makes a good question. We'll go over them one by one, and we'll start with focusing on a single important concept. Here's a quote. Nothing worth having was achieved without effort. And I want you to think, who do you think said that? Give you a couple seconds. And I'll let you know that it was this guy. You're like, I don't know who that is. Those are nice mutton chops. What's up with this? His button is unbuttoned. So this is actually Teddy Roosevelt. I just thought this is an interesting quote, and it really applies to this. The more effort you put into a question, the better it's going to be, and it's going to be helpful for you, and it's going to be helpful for others. So we'll first start with a basic rule of question making. It's the single important concept. So you want to be testing one piece of information that you want the tester to understand, okay? You want to have goal-directed questions. So you want them to learn something. You want to find that concept, and you want to teach it, and you want to work backwards from that concept. And I'll show you what I mean by that. So you get a single concept, a real small piece of information you want to know. You elaborate it more with a learning objective, so kind of fleshing it out more, and then you kind of mask that into a question. And we'll give you some examples of that. So now we're talking about, I'm going to write a question. I want people to understand that Graves' disease is caused by activating thyrotropin receptor antibodies. Okay? Simple fact I want people to know. Now, how am I going to teach that to them? Well, I want them to have a learning objective. This is the learning objective I kind of fleshed out more. So Graves' disease is an autoimmune condition caused by activating thyrotropin receptor antibodies, which stimulates excess thyroid hormone production from the thyroid gland. All right. And then finally, the question. Okay, so it's usually a clinical vignette. A 24-year-old female presents to the physician with palpitations. She's found to be tachycardic and has proptosis. Blah, blah, blah. Which of the following is the most likely mechanism of this patient's disease? All right. So there we go. We want to focus on a single important concept, and then we elaborate it more into the question, okay? But at the end of that question, I want them to understand what is the mechanism of Graves' disease, okay? And I just want to say that teaching is really essentially putting ideas into other people's heads. So you want to be effective with putting that idea and coming up with the nugget of information you want them to know, and then building the question is probably the best way to go. So next we'll talk about application knowledge versus isolated facts. This is a big deal. A lot of students get stuck on isolated facts, memorizing flashcards. That's great. It's helpful sometimes. But really, we want to be using critical thinking skills, all right? That's going to make us have a long-lasting memory, okay? Those skills are reasoning, evaluating, problem-solving, decision-making, and analyzing. if they're not doing one of those with your question, then it probably is not the best question, okay? So we want two-step cognitive processes, so higher ordered. So we want them to know one thing that leads them to another, and we'll talk about that later. Clinical vignettes are a really good way to use critical thinking skills. And then how you actually ask the question really makes a difference. It could, it could make them, think differently about a subject. It could phrase it so that you have to know one piece of information before you answer the question. I'll show you what that looks like next. So I'll give you an example. So here's an isolated fact question. Which of the following are characteristics of Staph aureus? So we're just, straight up question. What are the characteristics of Staph aureus? Is it a gram-negative, gram-positive, coagulase positive, negative, spore forming? There it is. It's a fair question. That's a memorization, okay? Well, let's transform that question. Oh, here we go. So this is the thought process. So you're given this, so you already know this. You have to say, what is it? So you have to just think of this. So that's a one step. Now let's do a knowledge application. So a 23-year-old female presents to the physician with 4-day history of nausea and vomiting. 4 hours prior to presentation, she was well and attending a church picnic where she ate a thoroughly cooked hamburger, potato salad, and potato chips. About 1 hour later, she began to vomit, and her vital signs were within normal limits. Physical exam reveals slightly dry mucous membranes, but is otherwise normal. She denies diarrhea. What are the characteristics of the organism that is most likely to cause this patient's infection? So here's the thought process you need to answer this question. And this is really, reasoning. So your reasoning, you have to find the diagnosis. Then you have to understand what causes the diagnosis. And then you have to understand something about that organism. So you need to do acute food poisoning you have to come up with. Then you have to say, well, this is most likely Staph aureus because it's, quick onset from a potato salad most likely. And Staph aureus is gram-positive with coag positive and it's cockeyed. So that's how you figure that answer. The answer is E for those interested. That's a knowledge application. Now you need to know a lot more in this side than you do in this side. So we talked about critical thinking and knowledge application, and now we're going to talk about the structure of the question. So this is going to be really important. We want it to be like the real test. So we want to make it just like step 1 does, okay? So what did they do? All right, so there's really mainly 99% of the time only one type of question on the test. It's the one best answer type. And I'll break it down for you. So there's 3 parts to that. There's the stem, which is, the paragraph, clinical vignette. Then there's a lead-in question. That's the last sentence on the stem. And then a series of choices. Simple as that. That's what you see every time you take a test. Now included in that is the age, usually the age, gender, site of care, chief complaint, and duration of illness. So that should be in about the first sentence. And we'll show an example of that here. So here's a vignette. I'm not going to read it right now, but I want you to just look at it quickly. It looks like a regular old question, but I replaced some of these general words with areas. So the first sentence, we'll replace that with actual things. So a 24-year-old male presents to the physician's office. So age, gender, location, the chief complaint of intermittent headaches, chief complaint, and then duration for the past year. Okay, so that should all kind of be in the first sentence. So let's just break this down even further. So we'll split this apart. So we got that first sentence down, and that's really the standard intro. So let's go here to this part. This is really just kind of some background information and history. No past medical history, but explains that over the past year he has intermittent episodes of headaches, sweating, and palpitations. He states that these occur about once per month. He does not take any medication. So that's just background, more kind of filling out the history. So let's go down here to this area. So this is really where you put the physical exam and labs. Okay, so on examination, blood pressure is this, pulse is this, oxygen saturation is 100% on room air. He's a tall young male sitting in no acute distress. On thyroid examination, a hard nodule is felt. There are 3 sessile painless nodules at the tip of his tongue. Appropriate testing is sent. All right. And then lastly, the lead-in question. So what is the most likely diagnosis? It's a very common lead-in question. So we got the standard intro, the background, kind of data, physical exam, and then the lead-in question. And let's go to the answer structure. So this is the answer structure for that same question. There's 5 answer choices, usually around 5 to 7. 5 is kind of the standard. They're all similar lengths. There's one best answer. Well, I'll tell you in a second. And there's 4 distractors. Okay? Each answer is plausible. These are all kind of in the same vein, kind of could be on the differential diagnosis. And then, like I said, usual distractors and differential or semi-related condition. So that's really important. We want this to be real answers, not like what's the most likely diagnosis. Let's say cancer. They just write cancer. That's not like a good answer. You can obviously cross that out right away. Pretty easy. So let's put this all together. So here's the question. Here's the answers. Same thing we just went over. And you can guess the answer now. I'm going to tell you in a second. But the answer is meant-to-be syndrome. And let's talk about the hand test. So the hand test is really, if you write the stem of the question, can you cover up the answer choices and still get the answer without knowing? And the answer for this one is yes, because we know that this patient has headaches, sweating, palpitations. So thinking of like sympathetic discharge. He has high blood pressure. He's tachycardic. And he's a tall young male. He's got a thyroid nodule. This kind of leans you right towards where you need to be. And nodules on the tip of his tongue. So you can kind of narrow this down to, oh, he's having pheochromocytoma. Oh, wait, he's got some other features. This should be meant-to-be syndrome. So we talked about the structure of the questions and answers, and also the hand test. Let's talk about the explanation a little bit more. So this is going to, be about how do you explain the question. As I've said in other videos, this is the most important part. You're making this question in order to teach someone else. It's like writing an article in a journal. You're asking to get this published so that other people can read it. This is the main teacher of the test taker here. What it does, it corrects the error in the thought and logic of the writer, gives them feedback, okay, which is really important. Feedback for getting something wrong. This provides low-stakes testing, great for practicing, solidifying knowledge, and it's a mini review of the subject matter. I'll give you an example of what a good explanation would be. So here's a good explanation. So this is the same question explanation. So it talks about the patient presenting with sympathetic discharge, tall body habitus, thyroid nodule, and oral abnormalities. This is most likely consistent with meant-to-be syndrome, which typically involves medullary thyroid cancer, mucosal neuromas, can be in the oral cavity or gut, marfanoid habitus, and pheochromocytoma. Then it goes to further detail about this autosomal dominant inheritance, but 50% are de novo. There's the pathogenesis. It's a rearrangement of the RET oncogene during transcription, which encodes tyrosine kinase. So this is the general review, and this is super evidence-based, okay? You really need to back this up. You're kind of making a mini review article here. But just as important as that, why the right answer is right, let's talk about why the wrong answers are wrong. So you want to explain all the choices and distractors, okay? Because if someone picked the wrong answer, they want to know why did they pick that. You want to avoid negative phrasing, and you want to teach something about the wrong answers. I'll go over that a little bit more. So each wrong answer used to teach something. So choice A was multiple endocrine neoplasia type 1. And you want to teach that it's, you want to teach about it. You don't want it to say it's wrong, because we already know that's wrong. And I'll show you an example. This is an example of positive phrasing because it tells you about MEN 1 syndrome. It's teaching you. And let's just show you an example of negative phrasing. So if this is the wrong way to do it, if you said MEN type 1, choice A is wrong because the patient had pheochromocytoma. That doesn't really tell you much about MEN type 1. That just tells you, oh, you were wrong because you thought this. But let's teach you about MEN type 1, not just say it doesn't involve pheochromocytoma. So let's go back to this. We'll talk about MEN 2B, MEN 2A, choice B is characterized by this, that, and this. There's no abnormal body habitus, so you're telling, this is the main distractor here because it's close, or mucosal neuroma seen in this condition. And it gives you a little hint here. So that's a really good way to teach something. So you're learning about MEN 1, MEN 2A, you're learning about hereditary hemorrhagic telangiectasia, and you're learning about neurofibromatosis type 2. That's all in one question. You get to learn about all those. But on the other hand, if you write the question, you're going to have to know about all those. So you're going to have to really understand the differential diagnosis for this disease and a little bit about them too. I just want to talk about a little bit of the research. So competitive answer choices like this, these are all similar kind of on the differential. They help you to remember things. They actually have studies have shown that good distractors in questions will make you remember things about that subject even more and be able to apply that thinking to other subjects as well. Finally, just to tap off the end of the explanation, you're going to put the learning objective. And this is just like the boiled down, the key point, the stuff that you must remember so people who are in a rush, they can really understand. So there it is there. You can take a look at it, but it just says medullary thyroid cancer, mucosal neuromas, and Marfanoid bobblehead with pheochromocytoma is part of men to be syndrome, which is autosomal dominant. So we talked about what makes a good question, talking about the explanation, the distractors, how to write the explanation as a mini review, and we're going to go a little bit more into depth on distractors now. So let's talk about good distractors. This is a graph that shows kind of answer choices, and we're going to display them in a second. Over here is the most correct end of the spectrum, and over here is the least correct end of the spectrum. And all of your answer choices are going to fall somewhere on this line. And I'll show you, let's go to the question that we had earlier, and we'll show you the distribution of where I think these answer choices go here. So let's throw them on the line. So the correct answer was C. It's obviously the most correct because you're looking for the most correct answer. B, men type 2A, is similar to men type 2B, just some similar, some differences. So that's kind of the main distractor. Then these ones are a little less correct. So A is men type 1, and then the other two choices are the least correct. So that's a really good spread. That's kind of what you're looking for. Is you obviously want a definite most correct, but you also need some actual competitive distractors. So let's talk about a not good spread. Okay. Let's throw this up there. So the correct answer, I'm not going to give you choices here, but let's say A is the correct answer. But C is almost just as correct, and B is really pretty good too. So this would not be a good question because people would choose A, C, and B, and it wouldn't really be fair. Let's talk about another example. So here's an example where E is the only, relative answer that's correct. These answer choices are so far in left field, no one even knows what they're talking about, So that's not a good answer either. You don't make it too easy. And then finally, this is an example, this is not the worst because you can really correct this easily, but these two answers are too close to be accurate. These ones, maybe 50% would choose each of these. So here's an example. I'm not even going to give you the question on this, but it's an anemia question. And basically, it is a patient presentation, and it wants to tell you, it asks you, what is the mechanism of this patient's fatigue or anemia? So here's the answer choices. So we have a normocytic anemia due to destruction of red blood cell precursors. We have a macrocytic anemia due to impaired DNA synthesis. Normocytic anemia due to chronic inflammation. Microcytic anemia due to elemental deficiency. And hemolytic anemia due to autoimmunity against red cell antigen. So those are all great answer choices. And let's kind of look at the translation, the explanations. So when you write distractors, say you want all of these answers to be plausible and real things. That way, in the explanation, you could explain each one of these things. And these would all be on the differential in this case, because it's an anemia differential. So this choice A refers to aplastic anemia mechanism, choice B to B12 deficiency, choice C to anemia of chronic inflammation, choice D of iron deficiency, and choice E of autoimmune hemolytic anemia. So in one question, you're learning 5 causes of anemia. When you write this question, you'll understand it so much better. When you answer this question, it'll be explained to you really well, and you're going to learn so much just with this one question. And in real life, I'll tell you that when a patient has anemia, you're not sure which one of these it is. So these are on the differential, and being able to answer questions to differentiate these will be really helpful. So just kind of reinforce the wrong answer should be really mini reviews of why the wrong answer is wrong. And in order to do that, these have to be all plausible, real things that could happen to patients. So we talked about distractors. I'll just touch on discrimination index. So that's a statistical analysis of questions that tells you how good of a question it is. And that's what we do at Board Bank. We're going to have a statistical analysis. And it basically divides test takers into two groups. You have the low group, which aren't, scoring low, and then you have the high group, which are scoring higher. And this is top 25%. This is bottom 25%. And you can see how each question is good based on how good the good test takers did on it, okay? And that gives you a discrimination index and tells you how good the question is. So that's how we can analyze with a computer algorithm how good the question is that you submitted, not only in addition to the community ratings. So now we'll go to evidence-based real quick. So I want to just give you some examples of how to get that evidence for your question. So really important, if you want to write a question, submit it to Board Bank, you're basically submitting kind of a review article that's testing others. So it's really important you take it very seriously that you're disseminating good, accurate information. Because we all know if you learn something incorrectly, it will stick with you pretty long. We don't want that to happen. So review articles on a subject, so like in a journal like AnyJam or JAMA, just looking up a review article, that's what I did for the thyroid question. I just typed in Graves' disease in New England Journal of Medicine in the beginning of this lecture. And I got a review article, I read it, and I based the question off that. And then you can use an educational clinical website, so UpDate, which is big nowadays, and Dynamed. These are like kind of all the information there you need. And or you can use a review book like First Aid. These are usually more like isolated facts. You kind of need more of robust information to really make that question really good. So this is an example, the Dynamed, this is where I got the multiple endocrine neoplasia data. They actually, at the end of the article, they give you the source to cite, so it's super easy. You can copy and paste that into the site too. And then UpToDate tells you how to cite their sources as well. And this is an example of one that they give on their website. So we finished on what makes a good question. These are all the things. Let's review. So you want to focus on a single concept. You want to apply knowledge, not use isolated facts. You want to use the correct structure, which we went over. Thorough explanation, really important. You're teaching this. You want to make distractors plausible and reasonable and kind of on the differential. And then you want to really have this evidence-based. So let's transition to question flaws, okay? So this is, common mistakes that are made when people are writing questions. And we'll go through kind of examples of each of these. We'll start with multiple true-false. So multiple true-false is what everyone hates. It's the question that asks you which of the following is not true, all right? Or all are true except, or which one is not correct. So these are called multiple true-false because if there's 5 choices, you need to know that 4 of those are true and 1 of those are false. So that's 5 pieces of information you need to know for one question. Kind of unfair, right? So let's go over an example of multiple true-false. So which of the following physical examination findings is not a characteristic of an exacerbation of CHF, or congestive heart failure? Elevated JVD, increased lower extremity edema, an S3 gallop, pulsus paradoxus, and orthopnea. So it says which of these are not. Every time I get one of these questions, I forget that it's a not, and then I always look for the right answer, like which one is, and then I'm like confused. I think people get really confused with these. So you need to know the answer on this one is pulsus paradoxus, because this is not associated with CHF. You need to know 4 facts for this question. You need to know that there's elevated JVD. You need to know that there's edema, and S3 and orthopnea are characteristic findings. So that's kind of unfair, and don't do this when you're writing a question. All is true except which one is not correct are other ways to phrase this. Don't do this. Let's try to make an X there. So next we'll talk about none of the above. That's really, when you have none of the above, that's very annoying for students because then they're questioning whether any of this is true or not, and it's not really good for learning. So no use of none of the above. All right, instead of similar, it's also multiple true false, just like these, because you have to know if all these are true or all one of them is true. Next, we'll talk about imprecise terms. So, in your answer choices, you never want to say, say you say like CHF has one of these findings. You don't want to say frequently finding lower extremity edema or rarely lower extremity edema or sometimes. These are all imprecise terms. Like the word frequently shouldn't be used because studies have shown that when people are asked to define frequently, how often is frequent, it ranges from 70% of the time to 20% of the time. So some people think, okay, frequent is 20% of the time. Some people think 70%. So that just doesn't make any sense. Don't use any imprecise terms. The NBME doesn't do that at all. Next, we'll talk about irrelevant difficulty. Okay, so this is, we've all had these questions written by a professor that the answer choices are just so complicated. It's super hard question. We're not trying to make people get questions wrong. We want people to learn from these, and we want them to be able to use their reasoning. Okay, so to make it extremely difficult, would be not very helpful, and we would find out in our statistical analysis if that's a good question or not by the discrimination index. So options too long or complicated, sort of similar theme is, answers should be relatively short and concise, and the stem should be long. If options are too long or complicated, people get confused. They're trying to read stuff, can't remember what they read previously. So over here, we'll talk about long correct answer. So this is something that if you don't know about, you should. That a lot of times when people write questions, they'll always write the correct answer first. And since it's the most important information, they'll write it really long. So this is an example. A 54-year-old male presents to the emergency room with 2 days of decreased urine output. The patient has had watery diarrhea for the past week and decreased oral intake. Serum creatinine is measured at 3.2. There are no casts seen on urine microscopy. Which of the following is the most likely cause of this patient's acute kidney injury? So we got a diagnosis, ATN, post-infectious glomerulonephritis, intravascular volume depletion leading to decreased renal perfusion, benign prostatic hyperplasia, or acute pyelonephritis. This one stands out right here. This longest answer is the case. This helps, kind of smart test takers to get the right answer. So try to make all the answer choices similar length. So the next strategy students use that you want to avoid is convergence studies. So we'll go over this. It's really talking about a 54-year-old male, goes to the ED. He has also an AKI, except a little bit worse. So he's got renal almost renal failure, depending. And which of the following lab sets would be consistent with the patient's presentation? So these are one of those, you have to know 3 things and you have to figure it out. And the strategy for this type of question, which that's why you want to avoid these kind of convergence strategy, is you look for the one that kind of matches everything. So, for example, we have 3 questions that say increased potassium and 2 that say decrease. So most likely it's increased potassium. And we have 3 that say decreased bicarb and 2 that say increased bicarb. So most likely it's decreased because 3 versus 2. And then finally we have 3 that say increased and 4 that say increased and 1 that says decreased. So by just even knowing how many they are, we'll know that the correct answer is A. So that's the convergence strategy. Let's go quickly over always and never. You should never do this. If you write always in an answer choice, like this is always associated with this or this is never associated, those are usually wrong. And so that kind of gives smart test takers like a leg up. So you should just never write always or never. And then finally, grammatical errors. So when people write questions, they take a lot of time on writing the correct answer, but they don't take as much time in writing the distractors. Therefore, the distractors are more likely to have grammatical errors. So any question answer that has a grammatical error, is not the correct answer. So you want to make sure you have good grammar and you take as much time on the distractors as you do on the real question. So I talked about the discrimination index, and I won't go over the formula for that, but that really gives us statistics of each question. So when you submit a question to Board Bank, we'll see, how good of distractors you have, if this is a good question based on how people write it, and that's one way we can, figure out how to improve the question, or see if it's an appropriate question at all. So we'll be using that, and plus the users rate the question, so that's another way of ensuring.